So when my patients come in, my initial appointments are 2 hours. That's how much I block on my schedule anyway. We may not need that long, but it's nice to have that initial unrushed appointment to really get to know that person. If somebody were walking into the office, they may think I just do functional medicine, actually, because that first appointment really does look like a functional medicine intake. That's how I structure it. So there's we go through their timeline, and then where it starts to get a middle more like family medicine, I ask about family history, social history, colon cancer screening, all the basic preventive things I touch base on. We do a good head-to-toe exam, and then we talk through next steps in terms of lab work and what we're going to do based on their concerns. But I agree. I weave it in as functional medicine.
Hello, and welcome to Pursuing Health. I'm Dr. Julie Fouché, family physician and former CrossFit Games athlete. Here, I bring you information and inspiration to help bridge the gap between fitness and medicine and support your journey toward your healthiest self. Thank you so much for joining me. Now let's get started with this week's episode. Welcome back to Pursuing Health. I am so excited today to be joined by the one and only Dr. Lilian White, who I had the pleasure of meeting when I was just finishing up residency, and she was a medical student at Wright State University, and she went on to the same residency program at the Cleveland Clinic, family medicine, after I had graduated, but we've kept in touch, and it has been amazing to watch her journey. She is definitely one of the most impressive young family physicians that I have the pleasure of knowing. And it's not just because she's super smart and she has this incredible breadth and depth of knowledge, but it's really because of the heart that she puts into her patient care and the intention and her passion for advocating for improving primary care. I think we're in a time where for so many people, it looks very bleak. We have this sick care system that's really focused on putting Band-Aids on problems, and we have this assembly line medicine that is less and less personal as time goes on. We have really high rates of physician burnout and a growing shortage, especially of primary care physicians. But Lily is working to change that, starting with her own community. And so after she graduated from residency, she founded Empowered Health, which is a direct primary care practice that offers personalized holistic care using the best of her conventional medical training and also her passion for functional medicine and holistic health. She's an Institute for Functional Medicine certified practitioner. And I think this is so cool. During her first year in practice, she has already received the top 25 under 35 award by the Cleveland Professional 2030 Club and Cleveland Magazine's Best Doctors of 2024, which is voted by her peers. So amazing to already see her being recognized for her great care. Lily is an advocate for family medicine and holistic health, and she serves on the board of a number of organizations, including the Ohio Academy of Family Physicians Foundation, the Academy of Medicine of Cleveland and Northeast Ohio, and she's the president of the Northeast Ohio Academy of Family Physicians. She's also very active as a writer and contributing editor for the American Family Physician Journal and a senior author at Core Content Review of Family Medicine. So excited to dive in. I'm excited to have you on the podcast, Lily, and discuss your story, your path, and also more of your vision for what the future of primary care could look like. So thank you so much for joining me.
Yeah, thank you for having me. Such a kind invite.
So I thought we could just start with a little bit of your story and what led you to where you are today. So maybe starting with, your upbringing and what ultimately sparked your interest in becoming a doctor and going to medical school.
So when I was about 8 years old, I had an illness called HSP. Stands for Henoch-Schönlein purpura. So it's just a type of vasculitis or blood vessel inflammatory disease. And through that experience, I was in and out of the hospital for about a year, had all the complications, nephritis, intussusception, etc. So I got a good experience of the medical system.
And all of the, not the most run-of-the-mill medical conditions, but the things you learn about in medical school and don't often see that
right. Yeah. So when it came up in med school training, I was like, oh, I know what that is. But towards the end of that journey, my grandparents had found a naturopathic doctor that they had found very helpful for their own health. And they wanted to bring me to see him. And he ended up being just so incredible and healing, and really helped me to be able to now live a healthy life. So I had that experience kind of at an early age. But of course, being like 8 years old and having that experience, I was like, never becoming a doctor.
Keep me away from the hospital, please.
Which is, yeah, God just smiles when he makes his plans. But so I went throughout school and really just found myself, I had a lot of interests. I'm always a very curious kid. I would go through phases of learning about architecture for a few months, and then I would learn about there was like manatees, I remember, was a phase. So
I love that.
I would just cycle through all these things that I was curious about learning. But as I got older, I found medicine, it just kept coming up as an interest for me. It wasn't something that kind of came and went like everything else. So that was really cool. But I still didn't really decide to become a doctor until when I was in college.
Okay.
As things would have it, I had a history professor helping me sign up for classes during orientation, and neither he nor I really knew what we were doing. So I ended up in this chemistry class for science majors, but I didn't find out about it until later and ended up loving it. So it really worked out well. So through that, I joined the chemistry club, and we were on a spring break trip visiting all the science museums in Chicago with the chemistry professors. And one of them turned to me while we were like touring, I think, the University of Chicago. I remember this. It was like such a moment.
Yeah.
And he was like, Lily, like, what are you going to do with your future?
Wow.
And I was like, yeah, good question. And at the time I was like, well, science is really cool. I'm actually really enjoying this chemistry class, but I've really been interested in medicine, but I don't really know how to break into that field. My family isn't in medicine. It's hard to figure, like, how do I even shadow?
Yeah.
So he had an ER friend who was an ER doc that he was like, yeah, let's set you up with shadowing him. And kind of the rest is history. He helped me get into med school and navigate that whole course of things. So yeah, sometimes it's just having other folks help you along the way as you kind of share your heart with them, and they kind of are able to support and direct you in that way. So that was really, really helpful.
That's amazing. Yes, such a testament to having, what those moments like that you remember so clearly, being asked that question, and how those moments are those inflection points in our life, and then having the people there who can help guide us that make all the difference. So that's amazing. So you then go from chemistry to medical school, and at what point did you decide that family medicine was the right specialty for you?
Kind of interesting. It came about after I decided I wanted a more holistic path, actually.
Mm-hmm.
So when I was initially applying to medical schools, I was actually between naturopathic schools and allopathic schools.
Okay. Mm-hmm.
Having had that experience, when I was younger, I could really appreciate both.
Yes.
But then with my chemistry background and training, I just found that I wanted that more, it's not more rigorous necessarily, but I wanted that credibility that we do tend to publicly perceive the allopathic medicine as being, credible generally. So I wanted that training, but then I knew, okay, once I get that training, I really want to add these holistic components to it.
That's amazing.
So once I decided that, I got accepted to Wright State. Fortunately, they sent an email to like some of the new students, and they were like, hey, we're having this conference on integrative medicine. And I was like, oh, what's that? And then I went, and Mimi Guarnieri was speaking.
Wow.
Yeah, so I was like, so cool looking back. And I just remember sitting in the audience and being like, oh, people are already doing what I want to do. I don't have to like invent this.
That's amazing. And for those listening, Mimi Guarnieri is an incredible integrative functional cardiologist who she's on the faculty at the Institute for Functional Medicine. So that's super cool.
Yeah. So amazing to hear her speak. And so when I got to medical school, I was like, hey, is there anyone doing integrative medicine here? So I just kept asking that question to different preceptors. And one of them was finally like, oh yeah, Dr. Jonas, like that's what he does.
Okay.
And he's a family doc. So I just like ended up getting connected with him and shadowed in his office and loved it. And just kept asking to come back and shadow, and he kept letting me. So he really became such a big mentor throughout that medical school years.
Mm-hmm. That's amazing. I'm so curious for you on this decision. You had had this early exposure to naturopathic medicine and knew you wanted to do things in a holistic way, but then the decision to pursue, allopathic school. And I think it's something that I look back on for myself, and I remember being a little conflicted even to apply to osteopathic versus allopathic schools. And, the osteopathic philosophy resonated with me a lot more, but I came from a big university where basically all of the counselors kind of push you. They're like, well, you have the grades and the test scores, so you should definitely apply for allopathic. And I've often reflected on that. Like, I probably would have enjoyed medical school more, but maybe, as you said, maybe there's also a reason, why I took the path that I took. I think there's always a reason for everything, and how maybe we can bring more of that holistic perspective into, I'm sure you did, into your fellow medical students, to your faculty, residency program, just by having that mindset and asking those kinds of questions.
Yeah, no, totally. I think that's kind of one of the fun parts about writing, is like how part of how we change the world or medical thought is what we read and what studies we read and what articles we read. And so that's where kind of the passion from writing comes from, is that it is such a form of advocacy, and being able to bring the allopathic perspective, or having that allopathic perspective and bringing in that holistic lens, can be really powerful.
That's amazing. And I want to dive into more of your writing and advocacy soon too. But okay, so you meet Dr. Jonas. He, becomes a huge influence on your path. And he is a direct primary care doctor at that point. So you are actually exposed to direct primary care pretty early on. Can you share more about that and what really attracted you to that type of practice?
Yeah, so he was one of the early direct primary care doctors, or had started offering some of that in his practice. Initially, actually, when I was shadowing him my first year of med school, he was mostly insurance-based at that point.
Okay.
So I got to see him, going from room to room, and he's still just such a holistic, compassionate doc. He didn't really let it rush him too much. Like, he still spent a lot of time with folks,
Yes.
and gave very thorough, kind care. But it was really nice for me to see him go from mostly that to more DPC and having more time with patients. He also had more time to practice holistic health, right? It takes time to be able to counsel on nutrition and exercise and supplements and the risks and benefits of any treatment, really. So it was really just awesome to see him take the time and have the time to do that through the direct primary care model. So it's a monthly payment patients pay in order to have more time access to their doc. He was also, or is also, the director of the free clinic that's down there, the Bellbrook Open Arms Clinic. So it was really cool to see how being a DPC physician and having more time and flexibility in his schedule allowed him to really pour more into that, into his time in the free clinic and teaching med students.
That's amazing. So I have had guests on before who are DPC doctors and talking about this model, but just for those who aren't as aware, you mentioned it's a monthly membership. So patients pay monthly membership to be part of the practice, and it's really outside of insurance. So patients can still use their insurance for, if they would like, for, imaging tests or labs. Oftentimes as crazy as the system is, oftentimes those things are still cheaper to pay out of pocket through negotiated prices, but it's largely outside of insurance. And what that allows the doctor to do is to have less overall patients, to not feel like they have to see, 20 or 30 patients in a day just to keep the doors open, because of the insurance model, you're reimbursed per visit. And that allows you to have a lot more time with your patients. And so that's so cool. I didn't realize that you had actually seen Dr. Jonas make that transition. And I'm sure that was really just eye-opening for you. And at what point did you decide that that's the model that you wanted to pursue as well?
I knew that was what I wanted to do eventually during med school, just having seen him practice that way. I was like, as a integrative holistic doc, it just makes so much sense. The model just empowers docs to be able to practice integrative medicine, I think. But I was still undecided about when I wanted to do that. So during residency, I was still kind of between, okay, do I want to go ahead and just start the practice, or do I want to practice for a few years and then make that transition? Because it is daunting opening your own practice.
Yeah.
And, all the things that go into that ended up being very, very doable. But at the time I was like, okay, this is a big jump. What really pushed me over to decide to start the practice right after residency was a trip that I went on. I was teaching a couple workshops on integrative medicine for students at the Heart elective in California. So I flew to California. This was during residency, my second year. And I was there for just a long weekend. But I had some time to just go down to the beach and just think. Which, as you know, residency, you don't always have time to just reflect and what do I want?
Yeah.
So it was such incredible space to have. And I remember being on the plane ride home, and I was like, yeah, I just I need to do this. I just need to practice my values, and I just need to take this leap. And so that's what I just felt God calling me to do. So I just decided to go for it. But yeah, so it can be a hard decision.
Absolutely. And I think there are so many, it's scary. And there's so many different voices and forces that are trying to invoke fear, I think, or to prevent you from going that route, right? The big hospital systems would much prefer you work for them. And so they're trying to keep every, new doctor in their system. And I think also just going through medicine, it's a profession where so much of our training is laid out for us step by step. Okay, here's first year and second year and third year and this board exam. And then you have few decisions to make, what specialty, what am I going to do, my little free time outside of patient care. But for the most part, it's a very well-worn path. And so the idea of going out on your own, especially now when so many practices, independent practices, have closed because they're not able to keep their doors open and they're part of big hospital systems, it feels very scary. And so I think one of the things I'm taking away from what you just said is, one, having the space, providing yourself the space to reflect on what, for anyone in any life transition or any big decision, it's making sure that you have that space to reflect and really check in with what it is that you want, not what is everyone else trying to get you to do or think is the only option. So that's so amazing that you had that time. What else do you think was helpful for you? Now you said, looking back, okay, it wasn't as scary as maybe you thought it was going to be. What else was helpful for you in being able to make that leap right out of residency into opening your own practice?
Yeah, good question. I would say one of the biggest things for me, and I think this makes sense for a lot of things, is just support, having the community behind you. There are so many physicians now that have made this transition or started DPC practices. Last time I looked, at least 3,000 of us across the country. We have a big Facebook group, so there's a ton of us on there. And I had kind of been, peeking on there for the last year or so before I made that decision. And just being able to see people so happy to help one another and answer questions and have a resource to go to, I think is huge, right? You're starting a practice on your own, but not on your own. You've got this huge community behind you that you can go to with questions or resources. And then there's also, at this point, there's been a good amount of us have started. There's checklists. So I just kind of simplified it and okay, here's several checklists. I kind of put them together and just made my way down the checklist like a good type A personality,
Yeah.
And so that really helped a lot. And then the other, I think, big thing that was very helpful for support was I had a mentor who was so kind and generous and offered to, I asked him if he was willing, and he was very generous with his time, and was willing to meet with me once a month just for 30 minutes, maybe an hour, and just answer the questions that I had built up from the month before.
Yes.
So that was super helpful because questions, definitely come up and you don't want to feel like you're messaging someone every day. So I was like, can we just meet once a month and I'll bring you my questions.
Yes. And I'm sure that brought him so much joy and fulfillment. And for you to feel like, okay, I have a place where I can ask these questions. I don't have to, stress about them. That's amazing.
Yeah. Super helpful and very doable. The checklists are available. The DPC Alliance is a nice one. There's bagel checklists. there's quite a few of them out there, but yeah, it's really not too hard. You just kind of go down the list.
Thank goodness for all the people who came before who helped
Right,
pave the
exactly.
way, right? To make it
Yes,
not
yeah.
as scary. That's amazing. The last time I went to a DPC conference was probably 5 years ago. So I'm sure it has evolved so much more even since then. But I had that same feeling, like you said, it's just this community of people who are so passionate about what they're doing and so willing to help others and excited. They're like, the more people we can bring, because they've seen what it's done for their lives. I think especially the people who maybe were practicing in a conventional practice or an independent practice for a long time and maybe were burnt out. And now they have this newfound passion and love for what they do. They just want other people to also experience that. And so it reminded me a lot, honestly, of the CrossFit community, where it's just people who are like, oh, these are my people. Like we are on the same page. They are here to help me. And that I think is so empowering for someone to be making a move like you have. So that's awesome. So you decide you open up your practice. It was a little over a year ago that you first opened your doors, and you have a really powerful mission statement for your practice. So it's called Empowered Health. The mission statement is to encourage healing and health through holistic, relational, and empowering care. And it resonates so deeply with me, but I would love for you to share a little bit about what that means for you, especially those three words, holistic, relational, empowering, that were very intentionally chosen.
Yeah, I would say, so one of the big things that, we talked about holistic and how that's such a big part of my value system. I think we can take the best of both worlds. There's good things on the more holistic, naturopathic, alternative, whatever you want to call it, side, integrative, functional. And then there's, the allopathic, the conventional side that has some good things too. So it's really, let's be holistic. Let's just take the good things from both sides and use them as people's values or as they want those different things. We all have different value sets as far as how much of one or the other we'd like. And then relational comes from, just my values of being a family doctor. I think, there's so many specialists, so many ways to practice medicine or so many categories of medicine. So gynecologists focus on women's health or the women's reproductive parts. So you've got urologists, which focus on the opposite, and males. And I just think what makes family medicine so unique is that we don't focus on a body part. We focus on the person in front of us. Like, that's our specialty, is this relationship. And I think just being like part of the reason I decided to start the practice is just from a moral perspective. I just felt like the medicine that I offer patients and work with patients with is done. Yeah, you're just able to do it so much better when you have time for that relationship, just like any other relationship, right? If you don't see your husband, you don't talk to him, you don't call him. When you're sick, you don't get in to see him or say hello. Like, that's not good for the relationship. So this model of DPC and starting this practice was really born from, I want to practice medicine in line with my values and how I can best be in relationship with my patient. So really DPC is just how I was able to have that way of practicing medicine. If it was something else or there were another way to do it, I would do that. But this is what allows me to practice medicine in line with my values. And then empowering actually comes from a conversation with a friend. So we were talking one day, and at the end of the conversation, I was just like, wow, I just feel so empowered, like to like go out there and like live healthier and make some changes. And I was like, this is how I want my patients to feel when they leave the office. Like, I want them to feel empowered. And of course, we give recommendations and things, but at the end of the day, it's really about helping people themselves to live a healthier life. We can make recommendations, but I really want them to like embody and be empowered to go out there and live healthier and advocate for their lives. So that's really where the mission statement came from.
So beautiful and so true. Like, at the end of the day, our job as doctors is to educate and teach and empower patients to make the best decisions for them. And so often, I think where patients, have a lot of mistrust with the conventional system is where they feel like that's not the case, where they're being pushed, certain treatment recommendations are being pushed on them without a good understanding of who they are, what their values are. or allowing them to be fully informed and make the decision for themselves. So I love that you focus on that and that you have time for that in your practice. Now, okay, I want to talk about this topic of the way that you integrate holistic and conventional care, because I think, being in the DPC community, so many direct primary care practices are still, quite conventional. I think there are some that incorporate a lot of, holistic care as well. But then you also have a whole industry of, integrative, functional, alternative medicine out there. And oftentimes they don't communicate well. And so patients are feeling like, well, I have an acupuncturist and I go to this person for my nutrition, but I have this primary care doctor. And so it still is a lot on the patient to try to integrate all of those things. And I think there's also this misunderstanding from doctors too, that it's financially feasible to do both. Like, oh, if you're going to do if you're going to be a functional medicine doctor, you have to charge this much money to keep your doors open. And so I'm so curious about how you approach it, because I think we're on the same page that good primary care should be holistic and functional primary care. And once you see these frameworks, you can't unsee them. You can't put them in little silos and boxes and turn them on and off. And so I'm really curious about how you have approached that and how, what your care looks like for your patients integrating both of these.
So when my patients come in, my initial appointments are 2 hours. That's how much I block on my schedule anyway. We may not need that long, but it's nice to have that initial unrushed appointment to really get to know that person. If somebody were walking into the office, they may think I just do functional medicine, actually, because that first appointment really does look like a functional medicine intake. That's how I structure it. So there's we go through their timeline, and then where it starts to get a middle more like family medicine, I ask about family history, social history, colon cancer screening, all the basic preventive things I touch base on. We do a good head to toe exam, and then we talk through next steps in terms of lab work and what we're going to do based on their concerns. But I agree. I weave it in as functional medicine. I would really, in an ideal world, I would just call it good medicine. I wouldn't even label it as anything.
Yeah.
It is nice to have the label, because then we can all gather together and you're like, oh, you're interested in functional medicine too. It gives us that language. But really, at the end of the day, for me, it's just good medicine. So that's just how I practice family medicine and primary care. And then in terms of functional, primary care versus functional medicine, likewise, I just found my interest in functional medicine. I really, at the end of the day, my heart is a primary care doctor. I love and family doc. I just love the longitudinal relationship and really getting to know people.
Yeah.
Whereas some functional docs, they, do good medicine, but it's more of a consultant. So you see them, they get better, and then kind of move on.
Yeah.
But I was always that med student that was like, what happens to that patient? I always wanted to follow up.
Right.
And I just really, there's this year has shown me there's just not so much, so satisfying to be able to care for people. My patients really do feel like a bit of an extension of my family.
Yes.
Someone calls and they're sick, yeah, of course I'm going to get you in today or tomorrow, and do my best to take care of that person. And then you get to see them through the ups and downs of healing. And so I just love the longitudinal piece of it. But for me, I couldn't separate the two. It just feels so cohesive, such a good way of practicing medicine. I couldn't offer primary care without offering functional medicine. It just wouldn't make sense to me.
Absolutely. And I think especially spending that time up front, with, you said, just the relational piece, really getting to know someone and understanding their story, it then sets the tone for you to be able to provide better care no matter what comes up in the future. It's building that relationship just the way you build any other relationship in life. So I love that. Do you have a typical, now that it's been a year, you have several patients who've been with you for a year or more, what does a typical course look like? So they do that initial appointment, get to know you, do some labs. What else might come up throughout the year? How else might they use your practice or interact with your practice?
So it's kind of like a good old-fashioned family doc is what I tell patients. So they do have my number. So patients are welcome to text when they, have a question, or someone had a rash the other day, they just texted me a picture of. So a lot of times we can just do care through text, which saves them a visit. It's easy for me, so it's kind of a win-win. And then patients are also welcome to call after hours if there's anything urgent. So they're not sure if they need to go to the ER or they would go to urgent care. I tell them, give me a call. I'll get back to them as soon as I can. I'm not a 24/7 concierge doc, but kind of like having a doc in the family. Those phone calls after hours, usually that's like a deterrent for people. They're like, oh no, am I going to get called all the time if I'm a doctor doing this? No, like patients, first of all, you have a smaller panel, but also because patients are almost like family, like they respect your time. Like they're not going to call in the middle of the night about like a cold. Like they're going to wait until business hours, or they're just very respectful. So yeah, I've gotten very like handful of calls over the last year and a half. So people are generally very, very happy to have your care. So
that's amazing.
Did that answer your question?
Yes, definitely. Definitely. What about, maybe you can highlight too some of the things I love watching on your Instagram. You share little insights from your practice and some of the things that you've done intentionally for your practice to feel different than you would in a conventional office. So like, I know you have a lot of plants. I know you've been very intentional about like the type of gowns, like nobody likes to go to the doctor and put on one of those really sterile gowns. So what are some of the ways that you like to infuse just more warmth into the practice and the environment?
Sure. Yeah, that's been so fun. And it's been kind of tricky actually, because initially I was like, oh, I'm a clinic. I'm going to need this, this, and this. And I was like, oh, I don't really want those things. Do I need those things? Like
thinking the status quo. Yeah.
Yeah. So I decided when I moved to my new office in August, I was like, the walls are going to be colored. So I've got this yellow wall. This is friendly yellow.
Nice.
The other one's called, I think, calm green or something in the lobby.
Okay.
So I very intentionally like chose colors that felt like kind of warm and inviting and help the nervous system. A lot of folks have medical trauma or just get nervous going to the doctor's office. So I wanted to make it as inviting as I could. I also have, like you said, lots of plants, which studies have shown can really help the immune system get in that parasympathetic state. I also have a family room. So this is a room with a couch, a little teepee. It's got a comfy mat that's easy to wipe down so kids can get down on the floor and play if they want. I've got toys in there. So I had a family the other day that they were new patients. So they just like came into the family room while I was with another patient. And they're like, oh, I hope it's okay. We just like came in and started playing. I was like, no, that's like the goal. It was so lovely. Yeah. Yeah. So it's just like so nice to be able to make like, hopefully provide those good memories for kids. So when they do go to the doctor's office, they have that good association with like toys and being cared for and the doc that knows them. And so I was very intentional about wanting a family room when I moved to the new office. And then, yeah, like you mentioned, in terms of gowns, I got like just normal, like nice dressing gowns. Because from my own experience, I was at like a dermatology office and I was like, I feel so exposed and these are so uncomfortable, like cold. And so I was like, okay, I want people to feel comfortable when I'm in the office. So it's been challenging to think of my own way of changing the way we normally do things, but slowly I've been incorporating some more of these things into it.
I love that. One thing that I imagine can be difficult is staying focused on what you're doing and not getting too distracted by all the other fancy objects out there. Like I think especially in this world of, functional medicine or, just preventive healthcare, there's so many shiny objects. And, I think why your practice works and why you're so successful is because you're really focused on like, okay, how do I protect the relationship? How do I like keep my overhead really low so that I can keep my number of patients reasonable? And so how have you been intentional about that and like stayed focused? Because I can imagine like there's, especially even when I was at the DPC conference 5 years ago, there were so many like cool new technologies and, ideas. And so it could be very easy to want to do it all right off the bat. So how have you been intentional about that?
Yeah, I have really been conscious about keeping overhead low, because if overhead's low, that means I can keep the price affordable for patients. If I did want to offer some more of these nice technologies, I'd have to raise their prices. And really for me, it's keeping my values at the forefront. So when I was in college, we had a speaker, we would have like a lecture series here and there. And we had one speaker that just highly recommended the 7 Habits of a Highly Effective Person book. I don't know if you've read it before, but
Yes.
so good. Yeah, it's just like a classic. So I read it and I was like, oh, and created my mission statement. And I actually kept up that habit since then. So every quarter when I was in training and in school, I would like look at that mission statement and refresh it if I needed to, and just like keep it at the center. And then now that I'm, out of school, out of training, I usually look at it every 6 months or so, or when I feel like, okay, like I have a big decision, let me really align with my values and make sure this really lines up with what I'm thinking long term. So that's been, I think, just very like super, super guiding. So I would encourage people to have like a guiding, value set, or sometimes that's talking to mentors or other people that know my values when it seems a little foggy to me. So I think values at the end of the day are huge. So for me, the value here was I wanted to be able to care for like the average person. So for me, it would be against my values to start charging more than they would be able to afford. So I do need to keep things in a reasonable realm in terms of spending and overhead.
That's amazing. Such a good pro. The importance of knowing your values, knowing what your personal mission statement is or your practice mission statement, and then actually using it, even though you know it, checking in with it and using it to guide your decisions in real time. And then I think the other common theme that I have heard coming up is this surrounding yourself with the right people, the people who are going to be able to help guide you and mentor you, but also the people who are going to be able to check in and kind of keep you in check with like, oh, does that decision align with your values? That's amazing. Well, I just from, looking at your website and reading the testimonials on your site and hearing about the awards you've already received, it seems like your patients just so appreciate the care that you're able to give them. And unfortunately, it is such a novelty. It's not something that you find in a lot of places these days. And so, one, could you comment on that? Like, I know you're a very humble person, but what are some of the things that your patients bring up to you as the things they appreciate most about your practice being different, or anything that's surprised you?
I think like I finished with a new patient, I remember last week, and he was like, I've never had an appointment like that with a doc that like spent that much time with me. So it really does send this like kind of subconscious message to people that like you are valued. Like a doc is spending time with you. Like that is just such a cool, like as physicians, we do have power to be able to help people to see the value in themselves by our own time that we spend with them.
Yes.
So that's just always nice to hear when I'm with a new patient. And then, I think it is just, kind of like other relationships, just having the accessibility. So I've had a couple patients recently that were sick, and we would just like message through a couple of things, and they're like, I would have spent hours in the ER trying to like navigate this. And it's like, I'm happy. It takes me a few minutes, like happy to help you. So it's just so satisfying at the end of the day when you're like, I feel like I'm taking good care of people. And that just gives you so much professional satisfaction to keep wanting to find ways to do it better and really enjoy the day-to-day work. I think we hear a lot about moral injury in medicine, and doctors just don't feel like they're doing a good job. Patients don't feel like they're doing a good job. So it's finding ways like DPC or other practice models that allow us to practice within our values and feel like we are doing, the career that we had set out to have. At my open house in October, one of my mentors came by, our friends, and he was like, how's it going? And I told him I felt like I was living my med school personal statement. I was like, it's so cool.
You don't hear that very often. That's amazing. And I think just like you've said a few times, it's like having a doctor in the family. It's like at the end of the day, don't we wish all of our patients were treated the same way that we treat our family members and advocate for our family members? And like, unfortunately, the conventional system often doesn't allow for that because it just doesn't allow for the personalization and the time. And the ability to provide that level of care to every single person, which is sad. And like you said, it's doctors aren't happy, patients aren't happy. It's often not working for anyone. So I know that, this is an amazing model that's working for you and is working for a lot of other DPC doctors, but, medicine at large is still struggling. And so I know for you, advocacy and writing are really big pieces, big passions for you. And you do a lot for family medicine and other organizations. So what inspired that? Cause you've always been, I remember even through med school residency, like you were always doing a lot of writing. And then, why is it so important for you to be on boards of organizations and really educating on what this model looks like?
So yeah, the writing kind of came out unexpectedly. So I remember I actually did quite a decent amount of, a couple of writing classes during high school and then college, but I never really thought of myself as a writer. Like that wasn't really part of my persona until, more recently. But during medical school, my last year of medical school was COVID. So 2020 is when I graduated. So during that time, they actually basically said med students stay home. Like, don't come into the hospital. Like, don't do anything. Like, just stay at home, do some online electives, if that. And I was angry. I was like, no, I'm like, you've told me I'm a valuable member of the healthcare team and you're telling me to stay home during a pandemic. Like, I want to get out there and help. So as it happened, I was on an elective with the local free clinic with Dr. Jonas.
Okay.
And I was like, I just went into like action mode kind of behind the scenes, and we developed policies for the free clinic and how to keep people safe as much as we knew. And so it was really still kind of active, but sort of undercover. But then during that time, I wrote an opinion piece. Okay. And that was my first, my first real publication of note. And yeah, learned some stuff about writing through that. I had actually submitted it to a couple of places for publication, and I didn't know at the time that that's a big no-no. Like, you should just do it like one place at a time.
Oh, okay.
I was messaging with an editor of like an actual, like a pretty big publication. And he was like, yeah, we're interested in this. And I was like, okay, like, let me know. And then it got accepted by this other, like, kind of, like Kevin MD blog, which is great. Okay. And then I told the other large, like, journal editor that it had been accepted somewhere else, and he was quite angry because I think he wanted to publish it. But I was like, okay, lesson learned, one at a time.
Learn that one.
But yeah, that really sparked my interest in writing. Is like, oh, this is a form of advocacy that as somebody who's more introverted, I can really get behind, right? Like, you can take your time to really formulate your thoughts, develop a good argument with references, and and then put it out into the world, and it can reach so many people, like way more than just like speaking at an event or something. So yeah, that really sparked my fire for writing.
That's amazing. Are there any favorite pieces that you've done?
Oh, good question. I don't know. I've really been enjoying, I've been starting to write for the AFP blog over the last, since the summer is when I started initially. So Kenny, Lynn, and I alternate. Okay. And that's just so fun because we just can pick like whatever cool medical topic I'm interested in lately and write a piece about it. And then as writing, what I love about writing is you're also learning while you're doing it. So it's also a way to stay up to date on like, okay, what does the latest research say about long COVID, for instance, and POTS? So I wrote that article recently. But yeah, and then finding ways to weave in more functional integrative medicine through that has been really nice too. Because there is a lot of evidence we can point to and be like, hey, this is something that could be practice changing. Yeah. So it can be so powerful. Like, that's really how we change how medicine is practiced, right? Is through these written medical guidelines. So if you can work on changing those or changing the articles people read, that can really inform practice.
That's amazing. What do you hope the future of primary care looks like? Like, if you could just step back and paint this vision, 20 years from now, what is it going to look like?
Yeah, I would love to see, and I think we actually are seeing some of this trend, more holistic care in family medicine, but across all primary care fields, I think would be so ideal. I think we're seeing this natural curiosity return to physicians who are practicing DPC or have more time to learn and stay up to date and care for patients. So when they do dive into the research or dive into how can I help this patient, we are I'm seeing at least this natural progression to lifestyle medicine and more holistic care because docs are just curious. They're just, now they have time to be able to look into those things. So I think as more and more docs are doing direct primary care or other models that allow for more time with patients, we'll see more and more holistic medicine just naturally as a result, is my hope at least, and what I'm seeing at least already to some degree. And yeah, I hope that, patients will start to say, that's my doctor again. Now, people change primary care docs so frequently, they don't really know their doc. It's hard to get in with their doc. That relationship or that's my doctor isn't really there. And would love to see more and more of that where people are like, yeah, this is who I go to when I need medical advice, and need first line care. That's what primary care is that first line of care and advice. So I would love to see more of that.
I love it. I'm on board. Let's make it happen. Well, I would also love to touch on, just like you said, having more time and a little bit more space to contemplate in direct primary care. I know when we've talked before, you said how important this was for you too, just personally. Like when we're going through medical training, there isn't a lot of time. Like you said, you had to go away on this conference to actually have time to be able to think and reflect. And there's so much to process from medical training. And that's one of the things I will always be so grateful for is that I graduated residency during COVID. So I had time and space to do a lot of deep introspection that I probably wouldn't have otherwise if I had rushed right into a conventional primary care job, and how important that time and space was for me. And so I am curious, what has been most helpful for you just in the process of healing from medical training in general, or giving yourself space to heal over the past, year plus?
Yeah, I think so much of it, like you mentioned, is just, time to think and have space and time to reflect. Yeah, are these my values? And am I living those out in everyday life? So I realized for me, family, I haven't gotten to spend as much time with my family during medical training as I would have liked to, just by necessity of the schedules. And I've been able to do more of that this year, and being able to spend time with friends and family is huge. I think these are the relationships that reflect back our values back to us, but also help us see oh, maybe that isn't who I want to be right now. Thanks for letting me know that I was rude when I said that or whatever, our friends and definitely our family will let us know. And that's how we grow, right? Iron sharpens iron. We grow in community. We grow when we're around other people that have our best interests in mind, and really direct us or speak those things into us. So relationships, just with family and friends have been so huge, and having more time for those has just been absolutely lovely.
I love that. Yeah, I think that's one of the most underestimated things is just the time and space, because so often when we have some, we feel like we need to fill it. And I have this free time, so I need to add these other things to my plate. And oftentimes it's uncomfortable just to sit in blank space, and because it means that we sometimes have to process things that are hard or have difficult emotions that come up. And for me, that's been really important, is just valuing the blank space in ways that, I didn't before, because it feels unproductive, or it feels like, feels like you're quote unquote being lazy, even though you're not. It's actually one of the most important things for helping make sure that we stay on a path that is really consistent with who we want to be and what our values are.
Yeah, that's hard to do.
It is. So my intention really for this conversation is hopefully that there are other people listening who either are in a medical field who maybe are inspired or feeling more open to explore a different practice model and not feeling so constrained where they are. Or maybe a medical student or someone who is thinking about medical school but is just not sure because our healthcare system is quite scary. And so hoping to provide just a window into what's possible through your experience. But also for people who are not in the medical field at all, but are patients that are just looking for someone to help guide them for primary care that is holistic, that is relational, that is empowering, and for them to be able to know that this is out there, that this is a model that is being used. So just before we wrap up, any advice you'd offer to others in medicine, whether it's doctors, medical students, aspiring medical students, any words of wisdom that you want to impart to them?
I don't know, wisdom's a strong word, but yes, my best advice would be, just, I think looking back, so much of what was helpful for me, because like you said, I think it would have been so easy to sign up with the local hospital system, right? Was sometimes the right path for you isn't necessarily the easiest. And having a way to check in on your values regularly is huge, whether it's through a therapist or a friend or family, or writing it down and looking at it once a week or once a quarter. I think just having your values and really knowing your values, doing the work to know them, is huge, because that will inform, okay, what are my next steps? Do I take this job? Do I not take this job? It's not a matter of looking at salary or all these other things that are also important, but is at the end of the day, is that going to feed your values? Is that going to feed your spirit? And that I think that's really, haven't had, a super long career at this point yet, but I think from the docs that I have seen that have done a long career where they're very happy at the end, they said, yeah, I practiced my values and I, continue to remain true to them. So my biggest advice would be know your values and find ways to remain true to them. Whether that means, sometimes that does mean opening up your own practice. If I had or joining a practice, switching jobs, if I had a practice that was doing what I do already nearby, maybe I would have just joined them, but I didn't. So I started from scratch. But finding your values and finding ways to live them out, I think, is really the key.
That's amazing. And I can resonate with that so much. I actually was just having a conversation about, I went through the process of creating a life plan for myself a couple of years ago. And I think what I realized was that, all the way up through medical training, I had very strong values and purpose in my medical career, or like what I wanted to do as a doctor. And at that point, what I wanted to do as an athlete. And I had like very specific plans and steps for each of those things. But I hadn't actually done the same for all the other areas of my life, for my relationships, for my spiritual health, my mental health, my financial health, like all of these other areas that are really important, but I hadn't brought the same level of intentionality. And so I think when you're pursuing something that's so intense, like you're in medical school and residency, like that kind of takes up most of your time. And so it can be easy to neglect those other areas, which I definitely did. And so being able to really sit down and think through, okay, what is my personal life mission statement? What is my personal values? And then how is everything that I'm doing aligning with that, has been so helpful for me. So it's so cool to hear you talk about that as well. And like we have like our kind of personal life mission statement and values, and then we might have a subset of that for our practice or our career. And often there's a lot of overlap, but that is a lot of wisdom. So I would give yourself credit for the wisdom you just shared there. How about any advice for a patient, someone who is frustrated by the conventional system, there's so many voices out there telling you like, oh, this is going to help you lose weight. This is the best fitness program. This is like, there's so much noise out there, and maybe they're just looking for some guidance in how to sort through it all. What advice do you give to them? And then how can people learn more about direct primary care in general, or find a direct primary care doctor in their area?
I think patients, at the end of the day, I think a lot of patients and a lot of us, if we need a medication, that's okay. But a lot of us would like to avoid it if we can, or find more holistic ways for our health. And there are docs that have those same values. So it's a matter of finding a doc whose values align with yours. One way, if you're more functional minded, there's the Institute for Functional Medicine, or IFM.org, if that's still they just changed their website. So I think it's still the same web address, but they have a practitioner directory. So you can look up by your zip code and find a functional med doc near you. And then for a DPC doc, there's a few different mappers out there. So if you just type in DPC mapper in Google, that has one of the main ones. You can just pop your zip code in and see who's nearby. And I appreciate the point you mentioned earlier. Not all DPC docs are holistic, but I would say a lot of them are willing to take the time to talk and have those good conversations. So still find the doc that's the best fit for you, but they do have more time and availability to be able to have those conversations, which is really, I think what a lot of patients just need at the end of the day is to feel heard and feel that they understand what these interventions or medications or supplements are going to do for their health. So that informed consent you mentioned earlier. So I think people we're conscious about our bodies, and that's a good thing. So yeah, DPC docs just have a little more time for that in general. So those are a couple good ways to find people near you. For those that are interested in like looking into DPC and maybe starting a practice or joining one, the DPC Alliance is a really nice resource. They've got some good checklists on there for how to get started. They've got some great weekend workshops. So I'm not affiliated with them in any way, so I've just used some of their things and I'm a member, so they're really great. But yeah, one of the good resources out there. There's a lot of them.
Amazing. Well, I ask 3 questions at the end of every podcast. So you're in the hot seat now. So they're easy questions. So the first one is what are 3 things that you do on a regular basis that have the biggest positive impact on your health?
Yeah, I would say number 1 for me is my faith. So I'm very involved with my faith community and practice devotions daily and find that to be so grounding for me. I can tell when I don't do those things. It makes a big difference in my health overall. I love yoga and Pilates. So those are I came to those when I was in high school. I started yoga and I've been practicing almost every day, like not every day, but most days of the week since then.
Wow.
So it's been about a decade of lots of yoga.
That's amazing.
Yeah. So like love the yoga. And then number 3, I would say is, yeah, my relationships are huge for me. So I feel like I've probably talked about maybe too much here, but yeah, I love spending time with friends and family. And someone recently asked me if I was an event, like what I would do if I weren't a doc. And I was like, maybe I would be an event planner. I just like love getting all the people I love in one room. So yeah.
That's amazing. And I think important for all of us to note that, okay, you had yoga in there, which was some movement, but like not all the things that when you think of health, oftentimes people I think underestimate the importance of the like mental, emotional, relational aspects of health. And so spiritual aspects of health. So I think that's beautiful that you highlighted those in your answer. What is one thing that you think would have a big impact on your health, but you have a hard time implementing it, or something you're working on?
Oh, good question. I think for me right now, I've been working on some strength training. So yeah, so for somebody who has done more yoga than strength training, I'm like, okay, how do I lift this thing?
Yeah, totally. Amazing. Well, love it. Happy to give you some tips there.
Thanks.
Then the last question is, what does a healthy life look like to you?
Yeah, I think a healthy life for me is eating foods that nourish me, having relationships, people in my life that we have a good back and forth relationship, feeling like I can move my body in ways that I want to. So being able to hike that mountain or hike that beach when I want.
Yeah.
Pick up the toddlers. Love that. And then, yeah, just feeling like fulfilled with the day to day. So for me, that means having a career that I love and enjoy, but also have other aspects to my identity like writer and advocate, and why I do have time on these boards. Like I never thought that I would be somebody on boards, let alone like multiple. But like I've always hated meetings. I still don't love meetings, but that's like, this is how we change medicine. We speak up, and if we don't have a seat at the table, our voice isn't heard. So yeah, it's again, just like living a life that is my values like personified.
Beautiful. Well, it's so beautiful to see you living that, having the space to live that, and living it for yourself, for your patients, for the people in your life. So thank you so much for sharing with all of us about your story and about your path and your passions. And hopefully this inspires some other people that, there's another path that can be taken. And I think seeing what you're doing, to me, it just feels so, you make it look, I'm sure it doesn't feel this way every day, but you make it look very elegant and simple. Like, it doesn't have to be complicated. Just, you're so clear on your values and you are living them, and you've leaned into you had to have some courage and some bravery to do things that are a little outside the mold, but like, you're doing it and it's flourishing, and it's beautiful to see that. And I think the more that we see that happening, the easier it is for more people to follow that path. So thank you for everything that you're doing to lead the way.
Aw, thank you.
Thanks so much for tuning in. If you enjoy listening to the podcast, please consider subscribing and giving it a 5-star rating on iTunes. It really does help to get the word out to more people.